my name's Rosie from Rosanna Grace Physiotherapy, and this is my first YouTube video, and I just thought I'd make a video following on from this morning's post, which was about cervical screening, with this week being Cervical Screening Awareness Month, which runs this week from the 10th to the 17th of June. I thought I'd follow on from the post and just discuss really what patients have told me about their smear tests and just experiences I've picked up along my career so far. So the first thing I wanted to talk about was that we are at an all-time low at the minute for women taking up their smear test offer. And I think this is such a shame. It's such an important part of women's health, and early detection is really, really successful for disease management. As part of our job as women's health physios, we often take a history of why that person has presented to clinic, and part of this history is a gynecological history. In this, I always ask women about their smear history, so I'll ask women, are their smear tests up to date? If someone says no, then I'm really advocating them to get that booked in, and really trying to encourage them. And what's really interesting is I'd probably say just as many people who say, oh no, I'm very aware I'm overdue and I haven't really got it booked yet, just as many women say that as to those who say, oh, I always have mine because I've previously had abnormal cells detected and which required treatment. So, and that's something I always tell those women that haven't booked it or are aware they're overdue, you know, that I meet people who just from routine smears have had abnormalities, and have been otherwise asymptomatic, which is really important. So I'd often then make a note of that in clinic, and when I see them again I'll ask them, and more often than not they've had their smear, they've booked it in and they've said, oh, I don't know why I delayed, it really wasn't too bad. So on that topic then I wanted to discuss what a lot of patients have said about their smear tests. So I've had women of all different ages. I see girls from 15, 16 up to women 85, 90. Smear tests usually stop when you're 65 and they start obviously when you're 25. Unless otherwise indicated. And most patients that I see following their smear will say that it was fine, they don't know why they got themselves worked up. And what a patient did reference her smear as, and it's always stuck with me, is she said, Rosie, I told my friend to book it in because she's had loads of STI tests, but yet she was so petrified about her smear, but it's exactly the same thing. And I think that's something that people didn't always correlate. So if you ask someone that has had an STI or a family planning health check, a smear test is a very, very similar examination. So you still have the speculum and they have a look and then they just take a little swab at the tip of the cervix. So it's one of those things that's more embarrassing and uncomfortable, but it should never really be painful. On that topic then, if someone has reported a painful smear, more often than not, these are women that might have vaginal atrophy, which is what we would call dryness, most commonly in postmenopausal women, or those that have had difficult childbirth, tears or stitches, perineal pain, endometriosis, or like I mentioned, vaginal dryness. And if that is the case, then there's lots of measures you can put into place to make it a lot easier for you. Using lubricants or moisturisers beforehand, letting the nurse know your anxieties or your pain that you have gone through, taking some deep diaphragmatic breathing, so relaxing your pelvic floor really helps, because often if we're tense and anticipating pain, we can't really relax and let go, and often that can cause a lot of discomfort as well. So there's lots of help there. Us as healthcare professionals want to make procedures like this as comfortable as possible, and I think anything women's health related is genuinely quite uncomfortable to even talk about, let alone go through. So if you take anything away from this video, please book in, or at least see your local women's health physiotherapist. If you do know that maybe intercourse is painful or even using tampons is uncomfortable, come and see us, let us help you and make that more comfortable. We really want this week to raise awareness so women can get detected and access treatment should they need it. Thank you.